A lot of times people are confused by what causes a heart attack. If you look at this model here, you'll see that this is a normal artery. A lot of times there'll be a buildup of cholesterol in the lining of the artery. We call this plaque. But most people think what happens is that this buildup of cholesterol just eventually obliterates the artery. But in reality what happens, this buildup that we call plaque becomes unstable. And when it becomes unstable, it can rupture. In other words, it just bursts open, as you can see in this model here. Well, the body tries to heal this rupture by putting a blood clot on it. And of course, the blood clot causes the entire artery to be completely blocked, causing a complete cutoff of blood to the heart, causing permanent heart damage, and we call that a heart attack. Here at Executive Medicine, we look at the heart arteries in a number of ways. One way is to do a calcium score of the coronary arteries. This is a test done on the CAT scan machine and shows if there's any calcium deposits in the lining of the arteries of the heart. Although you can have blockages without calcium deposits, usually there's some calcium deposits, and this is the first hint that trouble is developing. Then we also look at it with a blood test known as the ultrasensitive cardio-CRP. This is a blood test that measures chemicals that are released by blockages forming in the arteries of the body. And depending upon the result, it can say whether a person's in the low risk, average risk, or high risk of problems with these blockages in the arteries of the body. And then lastly, of course, we do various types of stress tests on the treadmill or bicycle, and this tells us whether the blockages have become significant or not in terms of just closing the diameter of the arteries.